I will be infusing a IV medication, so I've already done my first check, comparing the physician's order sheet to the MAR and doing my 5 rights. So my patient is Shane Schroeder. He presented with a GI bleed. Shane Schroeder, date of birth November 1st, 1968. Dr. J. Ames, Finn 0991749. He's allergic to morphine. My MAR has been double transcribed. I will be giving him pantoprazole. Pantoprazole given 40 milligrams IV daily. And on the monograph it says here, pantoprazole, it is compatible with normal saline, and it is to be reconstituted. It is to be reconstituted with 10 mLs of normal saline as well. So I will wash my hands. I will get a 10 ml syringe, and I will also get a blunt fill needle. So I have here my normal saline, and it is not expired. I also have my pantoprazole. I'll get a new one, pantoprazole as well, 40 milligrams for IV use, and it is also not expired. So I will uncap this. I've washed my hands already, and I'll wash my hands again. I will now get my alcohol pad. I'm going to get my pantoprazole, swab for 30 seconds, dry for 15 seconds, and also my normal saline. I will be swabbing for 30, drying for 15, and now with my 10 ml syringe and my blunt fill needle, using sterile technique, I'm going to wing it back, and also followed by my blunt fill needle, and I'm going to turn it back, and now I'm going to get 10 mLs of air, and I'm going to inject it into my normal saline.
Having alcohol weight to 30 and allow it to dry for 4 minutes. By lowering this right here, now this is the I'm going to back count. Alright, so good. I fully back primed. I still have some air in my chamber so I can see a drip. I've got that here, and I've got this replant. So next thing I'm going to do is program.
So I want to get 10 mLs.
So again, I have a volume of 110 mL, so going into my secondary here.
There's no air bubbles. And now I will remove this. And now I will inject it into my pantoprazole IV. I'll now inject it in and pull back 10 mLs of air. And now I will swoop my needle to recap it, and now I will roll this for 30 seconds to make sure it is well mixed. 30 seconds has passed. I will now swab this cap for 30 seconds again. I swab for 30, dry for 15, and now after swabbing for 30, drying for 15, 40 milligrams of it, I need 10 mLs normal saline, final concentration 4 milligrams per ml. I need 10 mLs. We've already done that calculation. I swabbed the top of it already, and now I will inject and still. I will scoop and recap. I will now show the syringe to the camera. I have no air bubbles, but I don't quite have 10 mLs. And here it is, and now I will write my label for it. I've also chosen a 100 ml mini bag because nowhere in the order did it say Shane was on fluid restrictions. So I will now write down about it. This is for Shane Schroeder, and this is Pantoprazole IV, and the dose of it is to give 40 milligrams of it, and the volume 10 mLs plus 100 minibag, making it 110 mLs, and the diluent is normal saline, and the concentration is 40 divided by 110 will make it 0.36 milligrams per ml, given October 19th at 1400 by me, HYL University Manitoba student nurse, 3rd year. So October 19th at 1400. And I will now put this onto my mini bag. So here's my completed label. And now I will do my second check. So right patient, Shane Schroeder, right medication, Pantoprazole IV, Pantoprazole IV, Pantoprazole IV, Pantoprazole IV, Pantoprazole IV, dose 40 milligrams, 40 milligrams. This is a 40 milligram vial, and then it says supply 40 milligram vial, add 10 ml normal saline for final concentration 4 milligram per ml. I do have 10 mLs to make it 40 milligrams, and then right route IV, 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 and this is IV, and the right time to give it has not been given yet. It's given on October 19th, 2021 at 1400 by me, HYL University Manitoba student nurse. And now what I will do is I will get my alcohol swab. I'll get my alcohol swab, and I will swab this for 30 seconds and let it dry for 15 seconds. I'll now remove this, inject it in, and then swoop to recap my blunt fill. This goes in the sharps, and now I will rotate to mix so that everything's well mixed. And here's my mini bag. I'm also going to need to bring with me my MAR and my monograph, and I'm also going to bring with me my secondary set, as well as my pen and my alcohol pad as well. So I enter into the patient's room and I do my entrance safety check. Beds in lowest position, call bells within reach. There's no fall hazards, patient's not in pain and distress. So here's my patient. Hello, my name is HongYang Lin. I'm a student nurse here to give you your IV medications. Can I take a look at your wristband? Shane Schroeder, fin 099-099-1749-1749. Date of birth, November 1st, 1968. Great. Can you tell me your first name and last name? Can you tell me your date of birth? Do you have any allergies? Okay, he told me he's allergic to morphine. So now I did my identification. I'll do my third check now. So right patient is Shane Schroeder. Right medication, Pantoprazole IV, dose 40 milligram, given in total 110 mLs for a total concentration 0.36 milligrams per ml. Right route is to give IV, and the right time is October 19th at 1400. I have not given it yet, so I'll be giving Pantoprazole. So I'll also check patient's PIV site. There's no phlebitis or drainage, and when I palpate it, it is not warm or cool to the touch. My Baxter pump is running the primary at the correct rate, and there's no kinks in the tubing. So I've assessed his IV site. Mr. Schroeder, I'll be giving you your Pantoprazole because you complain of the GI bleed, and side effects of Pantoprazole is that it causes some vomiting and dizziness. So Pantoprazole is known as a proton pump inhibitor, and it's going to help reduce amount of stomach acid you make to relieve your GI bleeding. Do you wish to take Pantoprazole? Yes, he does, which is good. So I wash my hands, and now I'm going to get my secondary set. I'm going to get my extender clamp, and I'm going to drop my primary below. And then next thing I'm going to do is I'm going to get my secondary tubing. My roller clamp is closed, and I'm going to spike my bag using a sterile technique. So I've spiked it, maintaining sterility, and now what I will do is I will hang it up to here. And now I'm going to get my alcohol pad as well, maintaining sterility. I'm just gonna drop this down here for now, using the port before the Baxter on the primary. That way, the Baxter can control my medication. I'm going to swab for 30, dry for 15. After doing that, I will now grab this, and I'm going to use sterile technique and connect it on. This was fully sterile, and now what I'm going to do is I'm going to hold this below the level. My roller clamp is closed. I'm going to back prime to get rid of all my air bubbles.
Yeah, my syringe had like a crack.
And I have no more air bubbles. I'm going to close my roller and hang it back up. So now I hanged it back up, and now roller is closed. I stop this. Stop. Secondary. So my volume, my rate to infuse is I'm going to infuse at 110 ml per hour. My volume to be infused is going to be 110 mLs. And then my callback is yes. And then I'm going to confirm secondary. And after confirming secondary, I'm going to open up my roller and I'm going to hit start. So now it is infusing. I'm going to watch for 3 drops. 1, 2, that's the second drop. And my 3rd drop. So now I'm going to document on my MAR that it was given at 1400 by me, HYL, University Manitoba student nurse 3rd year. My Baxter is running properly. There's no kinks in the tubing. Thank you, Mr. Schroeder. Here's your call bell. Please call me if you feel any pain or irritation at your IV site. I documented on the MAR. I'll do my exit safety check. I've also programmed a 15 ml normal saline flush from my primary, and that 15 ml normal saline flush is going to infuse at the same rate that my mini bag infuses at, and it's going to infuse when the mini bag is done. That way the patient can get all of his Pantoprazole medication. And I'm going to program, I have also programmed the callback to call me back so that I can see the mini bag has fully infused and that my primary is doing the 15 ml normal saline flush. I have programmed both those things. I'm done.